Coming up with this Act of 2020 relating to CRVS was all about improving service delivery, especially for those people who couldn't have the registration right. And having this demand from the citizens, considering that civil registration is like any other human right, a basic one actually, because you have to be registered, you have to claim that right, but in doing so, some citizens were facing challenges. So after the several assessments in service delivery, in governance, in decentralization, because this came after the assessment of decentralization, that means services that are decentralized in local government, we decided to come up with the Act of 2020, mainly to improve quality of service delivery, but also to make services more reliable and more affordable to the citizens or the service seekers.
People used to go to administrative entities or agencies to register death and the birth. So it was something very uncomfortable for the population to make a lot of movements or to make them travel many times to seek the services. So stakeholders, government stakeholders and other agencies, they thought it could be better to have the service integrated in the existing settings in the health sector, to allow people to access services. If somebody is not born in the health facility, he has to be registered because the registration is a law. So, but those born out of the health facility will be registered in the community with the sales executive secretaries. We have multiplied this by 5 because we have now over 2,000 sales which are registering death and birth happening out of the health facilities.
Building on the ownership and also the political will helped to attain this. But also doing several assessments regularly, more especially in service delivery. Of course, the role of the government is, first of all, is to keep on carrying out awareness campaigns. The government here I'm talking about is more especially at the local government level. Secondly is to call out the annual awarenesses, the annual inspections and assessments, to gauge yourself, how are you faring in that, and then understand what should be done. Thirdly is to have like the structural framework. If you have like a steering committee, which involves even the ministers, people at the central level, it helps you to understand the situation, but also to fix it.
With the collaboration with the other institutions in Rwanda, we have now one centralized system capturing data for civil registration. Death happening in the community will be reported using tablets, and data will be sent to the national centralized CRVS system. From that system, we'll be able to analyze countrywide the data happening countrywide. It is integrated with the system of death in the hospital and death happening in the hospital. So we will be able to, it has the same algorithm that can be matched, and we analyze cause of death easily for the entire country.
There is an order that mandates the cell as an administrative entity to do the verbal autopsies. The lowest entity that is near the community to carry out that. They are important because they help the communities, but even for the policymakers, to understand where the issue is and then set or lay out strategies that can fix the issues that have been raised or identified in the communities. It's the same thing of having these regular awarenesses to the communities through media fraternities, through communications channels. That's why the government plays a big role. Also engaging the stakeholders. That means there should be a working relationship between not only the central government and local government, but also engaging the legislature as people who enact laws. You create a framework where you can work together to solve the issues of CRVS.